Man, I feel like official in here.
It honestly, it doesn't get any more official in terms of equipment. The only thing I could have done that is more. The only thing I could have done to make this more official was do more stuff to the actual room itself. It's pretty dead though, which is what you want.
Yeah.
And there we are. Just get yourself a couple best
can't,
practices. Yeah,
I
that
don't
thing
want to
will
have to
move
hold
for you.
this thing because my arms hurt.
Yeah, just tighten it.
It's good.
You good?
Yeah.
Only thing I would say is just kind of keep that mic close to your
My
mouth
face.
and don't tap on the table. It's amazing to me how many people be like, and so what I did is then I went here and here and here and here and here, and it's like, okay, stop.
Noted. I will do my best to keep my hands off the table
Very good.
and my hair out of my face.
So we've got Monica McKitterick
That's me all day.
with, what is it, Impact?
Impact Family Wellness, my friend.
Cool. So just to kind of set the table with everything that I try to do with this is try to keep it, real estate focused a little bit, but also like entrepreneurial, because one of the things that I've identified is real estate agents, whether they know it or not, they're self-employed business owners, right?
Mm-hmm.
And so you're a self-employed business owner as well.
Yeah, no,
and
I can relate to that for sure.
So we'll get into that. And I like to talk about, kind of some of the things that you've done that have helped build your business, some of the kind of pitfalls that you may have experienced in your business.
I got plenty of those.
And then we'll talk a little bit about, what you do and how you can help other entrepreneurs, because I know you and I have talked a little bit about how that would be fitting. And then I always kind of open it up to the whole, like, if you have any questions for me, you let me know. But if you don't, that's all right also.
All right.
I'm on a lot of these podcasts, so there's a lot of me, going over loan stuff. But, starting from the top, introduce yourself. Tell us a little bit about what you do and who you are and all that kind of stuff.
As you said, I'm Monica McKitterick. I'm a family nurse practitioner, and I am the CEO and owner of Impact Family Wellness. So we are a direct primary care office, which basically means we take care of human beings instead of their insurance company. So we're a membership-based healthcare system. We have been in business for almost 4.5 years now. And, as I've mentioned, I have 3 degrees in nursing and not 1 in business. But I've figured out how to navigate it with a lot of Googling, a lot of research, a lot of mistakes, a lot of consulting other people who figured it out. And so thankfully I've been successful. We now have 2 locations. We have over 1,250 members now, and I have 6 employees. So it's been a journey. Thanks. Yeah. I mean, I met you, Matt, years ago.
About 4 years ago.
When I had, 12 patients.
Right.
And so it's been quite the journey. Turns out owning a business is not for the faint of heart,
No.
my friend.
No.
But, nobody told me that when I Googled how to write a business plan. So
yeah, nobody does tell you that, right? Everybody makes it sound like it's, what you need to do. You own a business because you don't want to work for someone else, and owning a business is like, if you're not doing that, you're messing up.
Yeah.
And like you said, you get into it and you recognize there's a reason why everyone doesn't own a business.
Absolutely. So people, my office is a little different, right? So we don't process insurance claims, and so we don't have a lot of overhead. And the big reason I opened it was because I was sick of taking care of insurance companies, and I wanted to actually treat people like humans. So people all the time are like, oh, it's so great that you offer this service. Well, I'm here to tell you, I'm real selfish because I did this for me.
Mm-hmm.
I did this because I wanted to take care of people how I wanted to.
Mm-hmm.
And so when I initially came across the idea, I went to my husband, who has an MBA, and I said, Dear Clayton, I'm going to open a practice where I can see less people, take better care of them, have more control of my time, and still make the same amount of money. And he laughed in my face.
He didn't think it was doable?
No.
Oh,
Because
okay.
he was like, yeah, that's not life, Monica. I don't know how you do that.
Okay.
So, did a lot of deep dive and wrote a business plan. And then, as we all develop businesses, we realize marketing is a struggle. Right?
Well, I mean, we always say in my business, he who controls the leads, kind of controls the flow of the cash. And you can have, that's actually what this podcast is kind of like the basis of, is that you can be the best at your business and you may get a few word of mouth customers, but how do you really get the word out and be known to the people
Hmm.
who don't know you? So that's really what this is kind of designed to do.
Yeah. Well, and you and I had similar stories where we both moved here
Right.
to open these businesses, and
Yeah.
I didn't have a following here.
Monica's an Ohio native.
I am.
Look at that.
Right? That's why we left. No, I'm just
Yeah.
kidding. But I moved here and I didn't have a following of patients. So, just like you, I had to start from scratch. If I
Hmm.
had opened this in Albuquerque, where I came from, I had a large following of patients, but I didn't. I had all new people that I had to convince not only that I knew what I was doing as a healthcare provider, but also that this business model was a decent idea. And so figuring that out has been a struggle for
Well,
sure.
yeah, let's unpack the business model a little bit because,
Mhm.
obviously I understand it, but for those that, are listening and paying attention, it's like you mentioned that the business model is ultimately like I think you called it a membership.
Yeah, so
Okay.
it's kind of like Netflix for your doctor is the
Uh-huh.
best way to say it. Somebody told me it's more like Costco because you trust Costco, but I was
Okay.
like, oh yeah, no, I get that. But Costco's a once a year membership, and ours is
Hmm.
monthly.
Okay.
So it's currently $75 to $95 a month for adults, $45 for kids. We also take care of a lot of small businesses, and you pay that membership fee, and then you can come in as many times as you want.
Hmm.
So when you're sick, or you're not sick, or you have a rash, or you need something, or instead of asking Facebook for medical advice, you can actually ask somebody who has a
Yeah.
degree in it, right? And so it includes annual physicals, all your lab work, all those sick visits, we do all the acute chronic management, prescription management. But ultimately, we do 70% of what we do via text message.
Oh, wow.
I don't need to touch you for
Right.
your rash, right?
Well,
So,
and again, just to kind of explain to some of the people, I feel like insurance and medical stuff, it's super confusing for a lot of
ugh,
people,
yeah.
right? And instead of, doing kind of the work and trying to figure out like what works, what doesn't, most people just, it's out of sight, out of mind. They want to avoid the doctor. They don't want to
Hmm.
go. I know people with great insurance that don't even utilize it. I know people with no insurance that are just constantly keeping their fingers crossed that they don't get hit by a bus.
Hmm.
So we talked about that it's a membership and everything along those lines. Um, this is ultimately for primary care, correct?
Yes. So we do a lot of primary and urgent care
Okay.
stuff. So just last week, in the last 2 weeks, I've had two employees of other businesses that we take care of cut their
Hmm.
hands. And so instead of going to urgent care, they call us, they come in, I sewed up their hands and sent them back to work. So yeah, we do all of that care stuff and urgent care. There's a level where I can't do it, right? You
Sure.
need an appendectomy. I'm not your girl.
I don't even know
Sorry.
what that is.
Taking out your appendix.
Oh, okay. Fair
Yeah.
enough.
Yeah. So if you need a surgery or you break a limb that is sticking out of a bone,
Right.
there's things that we can't do. Like there's a time and a place for a specialist.
Hmm.
But we do our best to take care of our patients. The healthcare system and the insurance-based world is very broken and
Yeah.
very difficult to navigate, just like real estate.
Sure.
Right. As a person on the outside of real estate, I have no idea what you do, Matt.
Right.
Like there's realtors and there's mortgage guys and there's title people, and I'm like, yeah, cool, right?
Well, we try to make it so that you don't need to know, right?
Exactly. And so just like your customers expect that from you, expect you to walk them through that. That's what we do,
Yeah.
right? And so we should not expect someone to know what a CPT or an ICD-10 code is.
Hmm.
That's not your job.
Right.
Yet that's what your EOB, explanation of benefits, means, and nobody knows what those are. And
Right.
so our patients just get stuck in this world where they just have to make a choice, and
Mm.
then their insurance company tells them who they can see and can't see.
Right.
It'd be like if somebody came to buy a new house and they were like, "Hey, I want the 2 bedroom, 3 bath with the upgraded kitchen." And then your insurance company comes in and says, "No, you can have the 1 bedroom loft
Yeah.
down the street in the ghetto. That's the only one you can have." We would never expect it. We would never accept that as consumers.
Right.
Yet somehow we've accepted that with our insurance companies, and it's garbage.
Yeah.
And so our office takes it back to the free market, right? Just like people come to you because they know that Matt and Gold Star Mortgage are amazing.
Yeah.
That's why they come here. That's why they come to us. Is
Sure.
their friends talk and they're like, "Oh, healthcare that doesn't suck. Cool. I'm here for that."
Well, and in addition to that, I feel like the main reason that I was so excited to have you on is because, again, the majority of the people that we're having on here are entrepreneurs that own their own business, and therefore they have to carry their own health insurance. It's not something that's provided to them
Mhm.
through their employer. And so, frankly, I'm not going to call anybody out, but I know a lot of self-employed business owners that are some that are not insured at all,
Hmm.
and some that are only insured for like a catastrophic event that, they have to get hit by a bus for it to make sense for
Sure.
them to even go to the doctor.
Well, for them to pay for it, absolutely.
Right, right. And so I guess my point is having you on, and I know who's kind of, watching these videos, and
Hmm.
and, and I think that a lot of people just don't know what you do. So having the
Sure.
opportunity to pay like a membership to allow for primary care, because if you're not paying for insurance, I mean, if I go to a general primary care physician, I can recall one time when I was younger. I mean, I broke my collarbone, right? And I knew that there was nothing they were going to do but like give me a $10 CVS sling and maybe a prescription for some pain meds. So I just was thinking, I don't want to go. I don't want to go. And then everybody freaked me out that, like my limbs were going to fall off if I didn't go. Sure enough, I sit with a primary care physician. I don't have insurance. He gives me a $10 CVS sling and a prescription and a bill for $500. And that's what people are terrified of. That's why they don't want to
Absolutely.
go to primary care when they don't have insurance for that exact reason.
Because there's
And
no price tag. Right? If
right,
you go to Starbucks and they don't tell you how much your coffee is, are you going to buy it?
market price, I
No.
believe that's what they call it in fancy
Uh-huh.
restaurants.
Yeah, right. Yeah, so we take all of that question out of it. So
Yeah,
we do take care of a lot of realtors, a lot of mortgage brokers, title people who aren't offered health insurance through their
I would think the
employers.
tradespeople.
Yeah. So really, anybody who's self-employed, we take care of a lot of them, and then sometimes they bring their employees on for us if
Yeah,
they have other employees. But yeah, we just make it affordable, and we take all the question out of it, right? So, which is what people want. They just want healthcare to be easy, right? So, in this same situation, if you had broken your collarbone,
yep,
right, I would have said, "Man, Matt, that sucks. Here's an order for an X-ray. That's going to cost you $50 down the street.
right.
Take this over there. Let me know when you're done. I'm going to pull up your X-rays on my computer when you're done.
Mm-hmm.
If it's displaced, okay, we need to send you to an orthopedic surgeon. But
Sure.
typically, collarbones just heal on their own.
Right.
So I would have called you up and said, "Hey, Matt, your collarbone's broken. Go get a sling. Here's a prescription for some pain medicine.
Mm-hmm.
Let me know if things aren't getting better. You need to work on some gentle range of motion of that shoulder so it doesn't get too stiff."
Yep.
And we would have called it a day, and the whole thing would have cost you $50.
Right.
And I don't actually have to ever touch you. So
Yeah. And that's out without having, some kind of crazy expensive insurance.
yeah,
Right.
absolutely. So, ideally, I want all of my patients to have some sort of catastrophic coverage, right? If you get colon cancer or some sort of crazy surgery, I can't help you,
Yeah.
right? But I would say probably 60% of our patient population doesn't have anything other than us. But we do our best to keep them out of it. We also have a consulting service where we can consult specialists free of charge for our patients. So it's just you just type it up. So yesterday I saw this lady with this disgusting wound, and she doesn't have insurance. Like, she probably can't go get help. I'm not a wound care specialist,
Yeah.
but I can talk to one. So I typed up a synopsis, sent it off, and then got a response back within a matter of hours and was like, "Okay, we're going to try this cream. We're going to do this dressing," right? Which isn't my expertise, but I was able to get the expertise without her necessarily
Sure.
going there, and hopefully we were able to save her toe. But yeah, it's simple things like that, right? That we save time, we save money, we save anxiety, which is what we're all looking for, to be honest.
Well, and I'm not an insurance agent, but yeah, I mean, the catastrophic part that we're talking about is like having that high deductible coverage just
Uh-huh.
in the event that something insane happens, car accidents, like we've jokingly said, getting hit by a bus. You mentioned colon cancer, and we have an insurance agent on, and those clips will come out here shortly. But yeah, public service announcement, guys, you should at least have catastrophic coverage.
Ideally so.
It's not that expensive.
Yeah, and whether that's a high deductible plan, there's really great health shares out there now, which are kind of like co-ops for health
Hmm.
insurance, especially for healthy people that don't have a lot of issues and just need that catastrophic coverage. I would absolutely have a health share if I didn't have a husband who works for a 1.4 million
Yeah.
person company.
Right. And,
Um,
and again, I mean, that's what I was excited to have you on is like, even if you have insurance, Monica's a great resource.
Oh, yeah.
But
Mhm.